With aging, it is common to have hip and knee wear and tear. But is it similar in sports? Let's find out. Hello fellow friends, I'm Erik Hohmann, orthopedic sports surgeon working at Bajil Hospital, Dubai. Welcome to the Hip and Knee series. Join me as we cycle away to learning the 4 W's of sports injuries. Welcome to the second episode of the Hip and Knee series. Today we're going to talk about the Posterior Cruciate Ligament, or the PCL. The PCL is the other ligament inside the knee that provides stability to tibial translation. It is the largest ligament in the knee and it goes from the back to the front. The main function is to protect the knee or the tibia from not moving backwards. So femur, tibia, backwards movement is stabilized by the PCL. How do they normally injure the knees? It is large trauma, mainly it's a direct blow to the knee, which we commonly see in car accidents or in high energy trauma. For a complete tear to occur, the tibia needs to move at least 12 millimeters backwards. Now you can imagine the tibia moves backwards, the femur stays where it is, you have your kneecap here. That causes increased pressure on the kneecap, and that by itself can cause pain. The ligament injury of the PCL is divided into different grades, grade 1 to 3, as you can see up here. The grade 1 is a tear with no displacement, grade 2 is a tear with partial displacement, and grade 3 is complete tear. And you can see on the picture up here how the tibia move backwards and how terrible the patellar femoral forces can. We grade PCL ligaments. Again, what's the natural history? We're not 100% sure. In general, PCL injuries do much better than anterior cruciate ligament injuries, but the majority of patients have some trouble with knee pain and osteoarthritis 15 years after they initially torn the ligament. Approximately 20% of patients have rapid development of pain and require further treatment. But it's not all bad. Most of the people who have PCL injuries have no symptoms for at least 15 years. What do we do with the PCL injury? There's one important point to make. Prior to making any decisions, you need to make sure that it is a PCL injury, because we often mistake it for an ACL tear. This means you need to do a very thorough clinical examination and possibly even perform MRI scanning. The important part with PCLs is in general is not as painful as ACL injuries. So we can start off with rehabilitation and physiotherapy with an emphasis on strengthening, especially of the quadriceps muscle. Splinting is controversial, but can help when the tibia moves too much backwards. Who needs surgery? If you have grade 3 tears, as shown in the slide up here, you definitely should consider surgery. If you have ongoing instability, if there's severe patellofemoral pain, or if you have multiple ligament damage, surgery should be seriously considered. How do we do it? It is normally done by keyhole surgery. We call it arthroscopy. And we, again, similar to the ACL, need a different type of ligament or graft to reconstruct the PCL. Nowadays, we can use synthetic grafts. It is controversial, but in the acute stage, synthetic grafts such as the Lars ligament, as shown up here, provides good and reliable results. Thank you for watching the Knee and Hip series. I hope you learned a thing or two. We welcome you to make a comment or suggestions in the box below. And if you like this episode, please hit the like button. I'm looking forward to seeing you again at the next episode of Knee and Hip series. Cycle away.